Recording. And all right, I think we are good to go.
Okay.
So welcome to PoliticOly, Mary Ellen Biggerstaff. Thank you for coming on the show, and I'm excited to hear more about your campaign. And why don't you just go ahead and introduce yourself and talk about the office that you're running for.
Okay, sounds good. So I am Mary Ellen Biggerstaff. I am a nurse practitioner and with a doctorate in nursing and a master's degree in public health. I'm from Olympia. I've lived here for the past almost 31 years. I am fairly new to politics, but I've been very interested and following things. I've never run for an office before, but after 10 years of kind of working in community health and feeling very frustrated about the lack of momentum for Medicare for all of us not being able to pass that, I became involved in the local DSA and then have decided that I was ready to try running for an elected office. In addition to being a nurse practitioner and an assistant professor, I have 4 kids who are 19, 17, and 16. And I'm
That's
running.
awesome. So where are you as an assistant professor at?
Frontier Nursing. So it is a university that is started in the 1930s. It's dedicated to training nurse midwives and nurse practitioners in rural communities. So I travel up and down the West Coast and Alaska, visiting clinics and mentoring nurse practitioner students as well.
Awesome. Thank you for your work. So why don't you tell us a little bit about why you chose to run for the particular office that you did? So LD 22, Washington State House, and position 1, right?
Yeah, in position 1.
Yeah.
So I'm running for open seat. Yeah.
So tell us why you chose that seat, and maybe like what is your kind of strategy for why the House? You know, what do you want to do in the House?
Yeah, no, I think that's a great question. So I had been kind of contemplating, I was ramping up kind of my political activity locally and contemplating that I was interested in running at some point. I didn't intend to run this year. And then when Beth Dolio announced that she was going to leave her seat and run for Congress, you know, an open seat in the House is a pretty big, a good opportunity. And so I decided this was the time I wanted to do it. I kind of focused on the House for a few reasons. A bunch of you have asked me, well, for your first race, why haven't you run for city council? I actually live in unincorporated Thurston County, so there's a little bit of limitations onto what I can actually run for. And I really am interested in the House for a few reasons. I want to affect health policy is my number one priority, and not just health policy, but what's called the social determinants of health, which are all the things, housing, education, history of trauma and mental health and substance use that go into people's health and well-being. And I think that the state level government is really the best place to do that. And I absolutely love being a nurse, and I did not want to give up my clinical work completely. So I think a job like the county commissioner, which is an awesome job, and I'm glad people really are running for that, that is more than a full-time job, and there's really not room for you to do any extra work. And I wanted to make sure that I continue with my nursing career as well.
Yeah, that makes sense. So do you want to say maybe a little bit about your involvement with DSA or just your politics broadly, and how that relates to maybe your strategy in terms of accomplishing some of these goals that you're talking about?
Yeah. So I am a lifelong Democrat. That is kind of one of the key core tenets of my family, has always been, you know, Democratic politics has been a big deal. So even though I haven't been very active locally, that is something that I've been a part of my entire life. But, you know, like a lot of people, I have been slowly kind of, I think, drifting a little bit left. And the 2016 election was really changed how I looked at politics, and really feeling like, you know, it's not nicely just moving along towards this great future where things are going to be awesome, and we're going to figure out how to end a lot of income inequality and address issues of health disparities, etc. And Bernie Sanders was super inspiring, because I thought, you know, I'd always thought that those were nice ideas. And I would have always described that and said like, yeah, I think socialism sounds like that's probably closer to what I am. But I don't think it ever really occurred to me that that was going to be something that we would see a movement towards in my life. So along with enrolling and getting my master's degree in public health, I became involved with the Oly DSA primarily because of Medicare for All. And that really was we've done a lot of canvassing for both Bernie and for Medicare for All throughout the community. We worked really hard to change Representative Heck's opinion on Medicare for All. And that was also pretty eye-opening, as I didn't realize that I still really don't quite understand how you can be violently opposed to that and not be in favor of viewing healthcare as a human right. And so I've really loved being involved with the DSA because we're really focused on policies that we can implement, really involved in change and putting forth a future of what our government can look like and what our country and our society could be. And I find that incredibly inspiring, and I think it helps cope with a lot of the things that we've had to deal with in the last 4 years.
Yeah, absolutely. So let's see. So what's your take on the situation with whole Washington Medicare for All versus the national scene, and kind of where is whole Washington at exactly? I know the shutdown kind of threw everything for a
Yeah.
loop there. So
Yeah, because, well, Whole Washington last year, so Whole Washington is an organization that has proposed legislation to implement more of a public option for people in Washington state. It is not the same as Medicare for All in that it would not eliminate private insurance companies. I think it's pretty, it's a little bit up for debate exactly what can be accomplished at the state level. You can't do the things that you can do at the federal level. You're kind of dependent upon at least a waiver from the federal level to be able to use those resource money that we get for Medicare and Medicaid. But it's an awesome grassroots organization that they have done a couple things. They have had an initiative that got the state, the legislature to implement a working group that actually is still meeting despite COVID, that is looking at options of what universal healthcare coverage might look like in Washington state, what it could cover, what it could not, those options. And it was introduced in the Senate, but not introduced in the House this last year. So I agree that nobody knows exactly what the legislature is going to look like come January, and there's going to be some real significant budget constraints that are going to make it difficult for any real aggressive legislation to implement something like that, where maybe it would have been easier to have that happen last year. But at the same time, we're also facing 15 to 20% unemployment. A huge number of people have their employment is tied to their health insurance, and so there's only so much. The healthcare system will collapse if enough people don't have insurance. I saw amazing gains when the Affordable Care Act was implemented. That wouldn't have been my first choice of what I would have liked to have seen passed, but I saw people working poor and working class people be able to finally access healthcare that they just couldn't have before. Yeah. I mean, and so that was a profound and wonderful thing to see what a difference policy like that could make in people's lives. And so I would absolutely be in support of whole Washington. My first choice is absolutely Medicare for All federally, but I would be happy to support whole Washington legislation in the state legislature if I'm elected.
yeah, so yeah, I think that's a good take on that. Let's see, if folks are interested in helping your campaign, how are you doing it right now with the with the shutdown, and are you phone banking, and how can people get involved?
Yeah, that's a great question. And the good news is I've never run a campaign before. I'm working with volunteers, a lot of them from the Oly DSA, but not everybody is from the Oly DSA, and that we're very much committed to running a grassroots campaign. And I don't necessarily know exactly how a campaign is supposed to look like. And so that has given us a lot of flexibility and a lot of creativity. I think that has been really helpful. We're putting a lot of emphasis on digital campaigning. We're also doing, I'm phone banking and text banking every day. A couple of the volunteers are doing it pretty much every day with me, but we have public text banking and phone banking where volunteers can come. We sit in a Zoom meeting, we walk you through the process, show you how to do it, and we're available for questions to help kind of kickstart that. That's every Thursday and every Saturday. Additionally, we're asking people to, we're going to be starting at least weekly sign waving. So I'm going to be posting that on my website. We're going to trial run it this Saturday on the west side. And we've got, I think, 10 people are going to be showing up at least to wave signs and wave at traffic and kind of hold some signs that talk about my issues. Sorry, there's a helicopter going over my head. Yeah, and so if somebody is interested in doing any of that, that would be wonderful. They can email me. All the information is on my website at maryellenbiggerstaff.com. $5 donations are super appreciated if people are able to donate a little bit of money. I'm not taking any corporate donations. And like I said, I definitely want to do this as a community organizing event. If other people have skills that they would be interested in bringing to the table, we've done a lot of learning about web design and how to do social media effectively, which does not come naturally to me. So we're putting a lot of effort into that. And anybody that is interested, I would love to hear what they think they're good at or what they'd like to do. So, and we can put them to good use.
Yeah, that's awesome. And kind of a follow-up on that. What about the DSA? How are they doing meetings right now? And if folks haven't gotten involved yet with the DSA, is this a good time to be plugging in, and how would they do that?
Yeah, well, it's always a good time to plug in with the DSA. So yeah, we are having Zoom meetings. I personally am on the platform committee, and we're meeting regularly like we normally would, just over Zoom. Nobody's thrilled about that. We also have been pretty active, even though we're mostly doing social distancing. We have been pretty active. It's a DSA member that's organizing a lot of the Black Lives Matter rallies and everything in town right now. So we have been showing up as a group to do that, to register people for vote. We're trying to stay away 6 feet away from everybody and wear masks so that we're safe doing that. But you know, there's a real groundswell, and it has been building for several years, but the DSA is really booming, and I think that they're really placing themselves as a political entity to be paid attention to in Olympia. We're working on a platform that we can do. We're working on endorsing candidates in the seat in the Congressional District 10 and finding out who's in support of Medicare for all, kind of looking at about a bunch of different options of what we can do. So I think it's a great time if people have been thinking about it. You know, and I always encourage people, I'm very active. People should never apologize about what they have to offer, because not everybody's in a place where they can be going to weekly meetings and doing all sorts of things. And the same goes with my campaign. We want to hear from you, and we want you to be involved and engaged. And if that means you only reply to an email once every couple months, then that is totally fine. You can come with what you've got and where you're at.
That's awesome. Thanks for that update. So that's a good segue to the Black Lives Matter related topics. So, and I guess, I mean, there's a million things to talk about, right? But I guess my question is, what it would be your approach in the House specifically with regard to Black Lives Matter policy and organizing?
Yeah, well, obviously, you know, it's kind of interesting as I'm excited that this question is being asked so much. Obviously, I am white, and so I would not consider myself somebody that's going to be stepping up to be a leader in the Black Lives Matter movement or anything like that. But I think it's really, really important that we talk about racial dynamics and racism within our policies and in our systems. And right now, that is very much focused on police, but there are problems with embedded racism throughout all of our institutions, our education, our housing, our healthcare system, not just the police, but the entire criminal justice system, from prosecution, our drug laws, to incarceration rates and who's incarcerated. And I have been very inspired. I think a lot of people, it's a very popular book right now, but Ibram Kendi's work, where he talks about how to be anti-racist, and his whole theory really focuses that you don't need to worry so much about whether a person is racist necessarily. You need very much to worry about whether a policy is racist, and how do you have that racial lens on policies that you're writing and reforms that you're trying to make. So I at least feel very comfortable having, I should say, I'm comfortable with being uncomfortable and leaning into that conversation and engaging in that conversation. So I think that is something that I would bring. I have worked a lot in my research on what are the effects of racism within the healthcare and healthcare system. And how do nurses, what are steps nurses can do to actively change that, not just be aware of it, but actually change what are the harmful effects of racism on our healthcare that we provide. And so I think that I have a lot to bring to at least engaging that conversation. Like I think that a lot of what is in Black Lives Matter, that's called allyship. And so that's this role that I would hope that I would step into, that we need to make sure that we are looking at people of color as leaders, but that we can stand up as allies and make that really a part of the conversation of all policy that we're passing in the legislature and all reforms that we're looking at.
Yeah, I agree, and I think that's a good answer. Like you said, we don't exactly know what the makeup of the legislature is going to be. And it could be very similar to what it is now, or it could be very different, or it could be a little bit different. We don't know yet. And very different specific policies could be, possible depending on that makeup. So,
Oh, and
I guess, yeah, go ahead.
Oh, no, and I was just going to say, kind of as a follow-up, is one of the things that I mean, if I want to say specific policies too, at the legislature, you're not going to have as much control over policing, but in the criminal justice, I think two things that are really important to me and that I would consider anti-racist policies are implementing a law enforcement supervisory agency that looks at law enforcement across the state that is civilian, or at least not run by law enforcement. So it has that eye that they can really assess what are appropriate punishments, what are appropriate, I shouldn't say punishments, disciplines. And the other thing that I think is really important is we need to move toward decriminalization of substance use. I work a lot with opiate addicted patients, and I think we've made really good progress for marijuana, but we need to be looking at not locking up people with substance abuse and involving them in the criminal justice system. So yeah, go ahead. Sorry, I interrupted you.
Yeah, no, that's a good answer. I think it is important, as you say, to focus on how these issues impact healthcare and other topics where maybe that's not the big headline or the spotlight at the time, but those are important to focus on because those are a big part of the systemic racism.
Yeah.
And we hear that from I think from Black leadership here in Thurston County, as far as I've seen, is that there is a sense that there is systemic racism in the healthcare industry, and and all of that here as well as nationally. One more question about that is what's your take on what happened with I-940? And so that was passed, of course, and amended and adopted. And what's your take on how that is going, and whether that we've seen a lot of change from that yet, or what the next steps are?
Yeah, and I'm familiar. So that was the use of force, a law passing the use of force.
Right.
Because I don't work in criminal justice, I think I'm relying on people that do, and I have not heard particularly any impact from that myself. It's very possible that I'm just not, I'm reading what other people are saying and listening to other people, and that it just hasn't come to light. But the other thing that I have really also heard from a lot of people that are involved in kind of the prison abolition movement and defunding, talking about the reforms really don't make enough of a difference, that isn't strong enough. And that's why we need to kind of radically rethink what our criminal justice system looks like. So I like I said, if somebody has that information, I would love to hear that. I haven't heard one way or the other about, other than people saying, isn't it great that we passed this law? I haven't heard about anything about the implementation or how that is affecting the statistics.
Right. I guess what I'm hearing is pretty similar, and I don't know if that's just a matter of it takes time, but I think a big piece of I-940 isn't even the actual policy, but really the movement organizing that passed it. All of the indigenous tribes and all of the families who had lost loved ones to police violence, and I saw that out in the community when I was going to help with the I-940 signatures and whatnot, it was, you know, a lot of directly impacted people and a lot of solidarity-based organizing that made that happen.
Yeah.
So I think part of that is even just the movement that that pushed that. I don't know what the next steps on that are. You know, well, in terms of I-940 specifically, but I agree with you on abolition and reform and that take there. And so, like you said, you have a limited amount of control of policing and law enforcement in the House potentially. But what do you think that that you could do as a House member to push the conversation and the policy with regard to policing in Washington State?
That it's an excellent question, because there's a lot that needs to be addressed all at once. And so you know, as a freshman House member, you're not going to be able to, you're going to get selected for one or two committees, and you're going to be, you know, focused and kind of limited there as well. So it would absolutely depend what committee I was able to sit in. I would certainly think that there is great momentum among the progressive movement in Washington State. So I would be a part of that. And so I would be able to vote and help promote bills, and then share that also with the community. One thing that I would really like to do, and this is not specific to policy, but like I said, I'm from Thurston County. I intend to live here the rest of my life. I've lived in Lacey, I've lived in Olympia, and I want to make sure that a broader swath of people in the community that are often shut out are really involved in the legislative process and understand what's going on. So I think a lot of what I would like to do would be just communicating, even if I wasn't the one writing the bill and getting it passed through committee and getting it passed, that communicating what is going on and who are the stakeholders and how are those decisions getting made, communicating that to people to understand. Sure, if I could wave a magic wand, I would love to drastically reduce the Department of Corrections, help transition a lot of the people that work in that, because it does provide really good jobs for people, transition people to other employment issues, and I would love to work to decriminalize substance use and provide mental health and substance use throughout the state. I imagine that I would be the most useful on working on health issues. And one of the ideas that I would love to promote, and I would really like to focus on, would be to provide primary care, mental health, and substance use treatment at our county health departments. A lot of other counties do that, and I think that would help improve the access for those services immensely. And having access to those services also then allows you to start cutting back on the use of the criminal justice system to deal with those problems. That's a very long answer, but that would be how I would envision focusing on that right out of the gate.
Yeah, I mean, I think that's on point. Because when we're talking about policing, it's, of course, we're not just talking about cutting a police budget and calling it a day, right? We're talking about a fundamental restructuring of who we call in different situations, and having different crisis response teams, you know, with different expertises, and connecting all of these services. So I do think that answer is on point there. Anything else you want to talk about specifically?
No, I don't think so. At least off the top of my head, like I said, it's an exciting time, because I think for you know, the continuation of the civil rights movement, and seeing the changes of how quickly society is adopting these changes and these ideas that even 6 months ago would have sounded pretty radical to most people, I think is exciting. And I'm glad that people are out every day and across the country and putting forth the energy to that. And I think what is possible is changing kind of right before our eyes. So it's a little scary, but it's also an exciting time to be running for office and imagining what I might be able to do.
Yeah, definitely. And so thank you for running, first of all. It is, you know, difficult and time consuming and stressful, and makes an uncertain time even more uncertain, I'm sure. So thank you for stepping up to run. And I know you mentioned sign waving you have coming up. And I will post links to that and to your webpage in the video when I post this. And
yeah, and I have awesome volunteers who are keeping my events page updated. The other thing, I guess you said this was going to be posted. I was going to say I'm having a fireside chat on workers' rights on Friday, but this will be posted on Sunday. So, but if people want to check out my
but I'll
events
link
page,
to it.
yeah,
I'll
that
go
would
ahead
be
and link to that today.
okay.
So.
Sounds good.
All right.
Okay.
Well, I really appreciate your time. I know you got to go get ready for phone banking, and that is really important. So I'll let you go ahead and focus on that. But I appreciate your time, and good luck in your campaign, and perhaps we can catch up again in the future.
Yeah, like I said, like a lot of what I want to do is reaching out to people that haven't necessarily been politically involved and kind of letting them feel that they have a bridge to get in. So feel free to email me, or if anybody else has questions or comments, they can email me as well. Thanks for doing the podcast.
All right. Thank you, and have a good one.
Yeah, have a good evening. Bye-bye.
Bye.